When you face a health problem, you're taught to go to the doctors and get medicine. Medicine's gonna fix it, right? Well, hopefully, but what if there's a better way? Did anybody mention to you that there's a spice that outperforms a bunch of the medications that your doctor's recommending to you? Probably not. Hey Wellness Warrior, I'm Dr. Zyrowski, and it is no secret that pharmaceutical companies have spent billions of dollars convincing the general public that medicine is the only way. In their investments to control healthcare, they've also brainwashed you that the doctors that give you medicine, those are the real doctors. And those silly doctors that push natural methods and vitamins and stuff, well, those lunatics, watch out for them. They're quacks. They're not real doctors. They're not selling our products, they say. If ever there was a spice that puts existential fear in the bottom line of a pharmaceutical company, it's turmeric. Turmeric is one of the most thoroughly researched plants in existence today. Its medicinal properties and components have been the subject to more than 12,000 peer-reviewed and published biomedical studies, revealing more than 800 potential preventative and therapeutic applications, as well as 250 distinct beneficial physiological effects. Let's compare it, turmeric, to many of the mainstream medications. And we're gonna start with a very popular one, and that is a cholesterol medication like Lipitor, for instance. And if you're over the age of 50, there's a good chance you went to the doctor and they said you need cholesterol medication. But once again, maybe there's a better way. A 2008 study published in the Journal of Drugs in R&D found that curcumin from turmeric, which is its active compound that really helps improve your health in so many ways, which we're primarily talking about here today, this curcumin compared favorably to Lipitor on endothelial dysfunction, the underlying pathology of the blood vessels that drives atherosclerosis. It also reduced inflammation and oxidative stress in type 2 diabetic patients. And honestly, that's one of the amazing things about taking natural compounds that are found in nature. Not only are they helping with the particular issue that you're taking it to help with, but they have so many other benefits to your overall bodily health as well. Now let's talk about corticosteroids. If you've ever been in pain, if you've ever had an inflammatory problem in your body, you've probably been on corticosteroids. A 1999 study published in the Journal of Phytotherapy Research found that curcumin compared favorably to steroids in the management of an inflammatory problem in the eye known as uveitis. Now, curcumin was also found favorable in chronic inflammatory cases as it would downregulate inflammatory genes. Okay, this is very important to know. And this is why in my clinic, if somebody's in chronic pain, one of the main things we use all the time is you take curcumin, take a herbal mixture that is designed to lower inflammation. It works phenomenal. Sometimes people are on steroids, corticosteroids, and it doesn't work. And then we use the natural method and it does work, right? Because it acts different on your physiology. Now let's talk about Prozac, okay? An antidepressant. And don't even get me into how bad this whole topic is. I mean, we basically found out over the past couple of weeks that millions and probably millions of people were put on antidepressants that should have never been on them because they didn't do anything for them. So a 2011 study published in a journal found that curcumin compared favorably to antidepressant drugs in animal models. So let me say this. I hear all the time that I took a particular natural supplement, and this is going to be very important for the success here that you're going to have with natural medicine. So people say, I took a natural supplement, it didn't work. Well, there are actually three reasons that maybe it didn't work for you. One, you just didn't need it. You took the wrong vitamin herb for the problem, and that's okay. So you didn't need it. Two is the dosing wasn't right and it wasn't based on science. And three, you didn't digest it or absorb it well. So how does this pertain to the exact topic that we're talking about today? Well, turmeric. You have it in your cupboard, in your kitchen probably right now. You put it in your food thinking it's going to change your health and give you all the benefits we're talking about today, but there's only one problem. And it's not bioavailable at all, meaning that you don't absorb it well when you put it in your food. In order to get the benefits that the research tells you about, you'd have to eat bowls of this spice daily, okay? So it's pretty much impossible. So then you think, well, if that doesn't work, then let me get a supplement. And everyone sells curcumin supplements, right? So the next time you're at the grocery store, you grab some, and then boom, doesn't work. Well, the reality is you got the same problem. It's not bioavailable, and then the dose is so minimal in it, and they do this in order to drive down the cost per bottle, making you think that you're getting really a better deal than you are. You're just really getting ripped off. Ultimately, then, it doesn't work. Research is specific when it highlights these benefits. It's a very particular dose for a particular amount of time. with a particular level of bioavailability. Now, if you see someone go to the gym and they get in great shape, you don't think to yourself, well, all I have to do is go to the gym and I will too magically get in great shape. No, you want to know, how did that person exercise? Did they do cardio? Did they do weights? How heavy of weights were they lifting? How long were they doing cardio? How long did they work out in general? The details in this are the difference between success and failure. What I'll do is I'll put a link in the description to a curcumin that I use clinically. The dose is based on research and is using the most bioavailable curcumin that is made today on the market. Let's dive into the next thing that curcumin outperforms, and that is aspirin. In 1986, an in vitro and ex vivo study published found that curcumin has antiplatelet and prostacyclin modulating effects compared to aspirin, indicating that it may have a value in patients prone to vascular thrombosis and requiring anti-arthritis therapy. Think of how many people are in that position, and that's a lot, right? You get a little older, get arthritis in your joints, it's going to be beneficial. How about the anti-inflammatory effects? Or just, think of all the individuals who are taking anti-inflammatory drugs. It may be you. A 2004 study published in the journal of Oncogene found that curcumin was an effective alternative to 10 different drugs in exerting anti-inflammatory and anti-proliferative activity against tumor cells. Pretty amazing. And then even in the world of chemotherapy, there's a drug called oxaliplatin. In a 2007 study published in the Journal of Cancer, found that curcumin compares favorably as an anti-proliferative agent. Now, many people will tell you that the big problem with using natural methods is that they are not backed by science. And I have two things to say about this, and this is important. One is that much of natural healthcare science is ignored. There's not money to be made in it like there is to be made in medicine, okay? If somebody gets cancer, we're talking hundreds of thousands of dollars that is billed to the insurance company. It is an enormous industry, right? Now, two, the reason there is less studies on natural methods to overcoming an illness is because who is going to fund the studies? You can trademark a drug and make billions of dollars, but you can't trademark a spice that grows in the wild, okay? And so this is where you run into less funding for natural methods. Now let's talk about metformin, a very popular diabetic drug. A 2009 study published in the Journal of Biochemistry and Biophysical Research community explored how curcumin might be valuable in treating diabetes. They found that it increases glucose uptake and suppresses glucose production in the liver. Interestingly, they also found that curcumin could be 500 times to 100,000 times more potent than metformin in activating AMPK and its downstream target, acetyl-CoA carboxylase. Now let's talk about cancer real quick. And we've mentioned this multiple times because cancer is an inflammatory disease, and one of the things that happens is that turmeric really shines in the inflammatory area in suppressing inflammation. Another way in which turmeric and the components reveal their remarkable therapeutic properties is in the research on drug resistance and multi-drug resistant cancers. Dozens of studies show curcumin to be highly beneficial against cancer. So what's the answer here? Is it never to take a medication? Is it to ignore going to the doctors? Well, the answer is making sure that you find a doctor that is acknowledging natural healthcare science, using herbs, using vitamins, using a lifestyle approach, and giving you the proper information in order to improve your health naturally. That's what's important. You should never ignore your healthcare problem. You should never go and ignore medication without proper advice from a doctor. You need to make sure that you're taking an intelligent approach to your healthcare. So all of this is to say that you want to think on your own. You also want to be an advocate for your own health, and you want to know that there are natural methods available in order to improve your health and do it without all the side effects. If you enjoyed this video, I think you'll really like this video over here next.